Hello and welcome to the differences between acute inflammation and chronic inflammation. Guys, we are differentiating the two terms, looking at the duration it takes, the onset, the purpose, the cellular infiltration, tissue destructions, healing, the inflammatory mediators involved, the effect on the blood vessels, the systemic effects, and the examples in the two sections. So, welcome. Looking at the duration, find that acute inflammation is characterized by short term, okay, typically days, okay, whereas prolonged chronic inflammation is characterized by prolonged or lasting weeks to months or even years. Yeah, take for that example for chronic infections. Yeah, chronic infections like in hypertension, diabetes, yeah, cancer, find inflammation may be there throughout. When does it start in terms of onset? This one, acute inflammation is rapid in onset, whereas chronic inflammation is gradual in onset. It takes time, guys. What's the purpose of acute inflammation? We say that it's part of the immunity, okay? It's a protective response to injury or infection. Whereas chronic inflammation, it's persistent response to ongoing stimuli. Yeah, there is an injurious agent constantly in the body, so the chronic inflammation will be present there. In terms of cellular infiltration, acute inflammation is predominantly dominated by the neutrophil type of the white blood cells, whereas chronic inflammation is characterized by the macrophages and lymphocytes. Tissue destruction, we have limited tissue damage in acute inflammation because it just occurs for a short duration as compared to the ongoing tissue damage in chronic inflammation. So healing normally usually is complete. Okay, it normally results in complete resolution for acute inflammation. Whereas in chronic inflammation, it often leads to tissue fibrosis and scarring. In terms of the inflammatory mediators involved, we have primarily the histamines and the cytokines involved in acute inflammation, as opposed to variety of cytokines, chemokines, and enzymes for the chronic inflammation. So, effect on the blood vessels, you find that in acute inflammation, we have vasodilation and increased permeability, guys. And when there is increased vasodilation, it leads to the redness of that area. It is increased heat in that particular area. Increased permeability will lead to possibly leakage of the proteins, reducing the oncotic pressure, resulting in edema and swelling. For the chronic inflammation, we have altered blood vessel structure and function, just to try and sustain those changes that are brought about by these injurious stimuli. We have less systemic effects to occur for the acute inflammation, whereas the chronic inflammation is likely going to lead to systemic infections like fever, chills. Okay, those are some of the systemic infection examples. We have acute infections and minor injuries for the acute inflammation, whereas chronic inflammation, it's involved in conditions such as autoimmune diseases. So the cause is generally infection and injury or tissue damage for the acute inflammation as opposed to prolonged immune response or autoimmune diseases in chronic inflammation. So we have already said that tissue damage is limited in acute inflammation. I will not want to repeat, but in terms of the treatment focus, saying that treatment in acute inflammation focuses on underlying cause and symptoms, as opposed to chronic inflammation that focuses on managing immune response and symptoms. So thank you so much for your time. You can access the free quiz in the description section of this video.